Hi, everyone.
Hello.
Hi.
How is everybody?
Good.
You all look lovely.
Busy week.
Oh, yeah.
Today's my mom's birthday. She turns 88.
Oh, my.
Yeah, and she's going to get her second vaccine tomorrow.
Oh, good. That's a nice birthday present.
Exactly.
And she's doing well now, Anna Louise?
She's doing great. She's
Good.
doing well. And, now with the vaccines within reach, she can feel the hugs starting to come towards her, right?
Mm-hmm.
That'll be
My
good.
mom was going to come. She's 87, and she was going to come for the weekend. So she leaves me this long voicemail. Kath, I'm going to come for the weekend. Taylor's going to drive me. I'm like, oh, that's great, Mom. The next day she calls and she goes, I don't know what I was thinking. I'm not coming. I haven't seen her in ages. She goes, let's wait till we're all vaccinated. I'm like, okay, Mom. Sad. Yeah.
Yeah, we were hoping to bring the kids to the zoo at some point. We've got twins that are turning 3 in September.
Oh, wow.
And they're just at that age where they want to touch everything and their mouths go on everything. And so, just with the cases being a little bit wild in Alberta, we've kind of been pumping the brakes. But, it's so beautiful out. We just want to get back at it.
I know. Do you have girls or boys or one of each? Oh,
yeah,
aren't you lucky?
Yeah, they're truly two totally unique humans that just happen to be born at the same time.
Aw, that's so nice.
Yeah, no, it's really fun actually. We were terrified at first, but I have to say, having two children who are at the same developmental level, like they both like to run around and be crazy and scream or, this or that. Whereas, I think when you've got an older or younger sibling, the older child will be into different things and not the same as the younger child.
Bug each other.
Yeah, but the house is being destroyed at equally the same rate between both of them. So
That's so funny.
Yeah.
Aww. Well, we're so happy that you're here and that you've been willing to spend some time with us today. So we've got lots.
Thank you for having me.
Yeah, it's going to be good. We have lots of people joining either through Zoom or live on Facebook. So we'll probably have a few more people trickling in, but just before we get started, just a couple of kind of housekeeping things from me. We'd love to hear from you if you have questions. My only request is if you could put that into the Q&A for me. You'll see that on the bottom of your screen. That way it won't get lost in the chat section. We'll probably hold off questions until the end, just so we can get through the program that is set for today. And then at the end as well, if there's a question that we haven't gotten to, then we'll have the email address so that you can reach out on your own as well to find the answers you're looking for. So that is all from me. Kathleen, I'm going to hand it over to you to introduce our guest today.
Thank you. Well, welcome everybody and welcome Dr. Dana. We are super excited to have you here. And I also want to mention that you're going to be on our specialty series that we're doing for RDHQ. So that will be, we're really excited. We want to thank you for taking the time to be with RDHQ today.
Oh, well, thank you for having me. This is very exciting. So I really appreciate the opportunity.
So Dr. Dana van Eslande is a certified specialist in orthodontics and dental facial orthopedics and a fellow of the Royal College of Dentists of Canada, in addition to being a member of the Alberta Dental Association and College. Dr. Dana is currently in private practice in Calgary, Okotoks, and Canmore, and manages a dental study group in Calgary and has several publications in peer-reviewed literature. So a little bit of your history here before we get started. And so again, thank you so much for being here. I would like to start off by asking you, when is the right time to refer clients if they're taking a positive approach to their management, and what conditions should we be looking for?
So that's a great question to start with. So the Canadian Association of Orthodontists and the American Association of Orthodontics both agree that the first orthodontic evaluation should happen around the age of 7. And that way, the orthodontist can evaluate the child's growth and development, and we can determine if there's any immediate concerns like impacted upper canines. So these big teeth, they can erupt at an angle and put the roots of the lateral incisors at risk for damage, depending on their eruption path. And what's important is that this process is often painless. So sometimes we have patients that come in their teens, and they come in and maybe they've got some crowding, or maybe the reason that they're coming in is because, hey, you know what, that canine never did come in. And we take an x-ray, and unfortunately, sometimes we see that the canine has totally damaged the root of the lateral, and nobody had any idea. And of course, the damage is irreparable. And so you can imagine if we have a shrinking root, and if it gets to a certain stage and the patient or client has a bump to the front teeth, the tooth might be at risk of being lost at that time or at some time in the future. So we really like to assess early using the proper imaging to determine where the canines are. But there's also a lot of other conditions we like to screen for. You know what, let me pull up my screen because I have some pictures that may be helpful so that everyone viewing can see what conditions we want to look for in these children. So let me just share my screen. So let's see here. Okay, can you guys see my screen?
Excellent.
Okay, so again, the first screening should happen around the age of 7. We're looking for excessive overjet and deep overbites. So this is what an overbite looks like, where the front teeth, do you see my cursor when I'm moving it on the screen? Okay, so when the overbite, when the front teeth overlap more than what's clinically and functionally ideal. Now, ideal would be about 20 to 30%. So you can see this patient here is about 90%, maybe 100%. That's going to be problematic. Overjet is when we've got a big gap between the front teeth on the top and bottom. So that's a problem we're screening for as well. Excessive crowding. Now that's usually what, we can pick up on easily. I like to tell my clients, and I'm sorry, I probably will keep referring to, mine as patients because that's in Alberta, the term we use, but, interchangeable with clients. But when patients have perfectly lined up baby teeth with no spacing, they're almost guaranteed to have crowding in the adult dentition. So that, I have a lot of parents that come in and say, you know what, my child had just the most beautiful, perfect teeth, with their baby teeth. And I'm like, for me, that I know they're going to be walking in my door or one of my colleagues' doors at some point. When they have spacing, maybe they have a chance to not present with the crowding, but crowding is another one that we're looking for. Then we have transverse problems. So transverse problems are problems from the side to side. So what we're looking for is if the top teeth are biting on the inside of the lower teeth. And the reason we want to catch this early is because especially if we have asymmetry where the top teeth on one side are biting on the inside and the child has to shift to find a bite, what can happen over time if this is left is that the jaw will actually start to grow in this direction. So if we don't intercept early, we can start to develop a bony asymmetry in the jaw to accommodate the bite. The other problems that we're looking for are underbite. So of course, the lower teeth are biting in front of the top teeth, and open bites. So open bites can happen from thumb habits, finger habits. Sometimes the child will even have like a blankie that they suck on, or a tongue thrust can also cause an open bite. And sometimes there's an unknown etiology, which just means that we ask the parent and they say, you know what, I don't think so. I don't think there's been a habit, and I don't think we have a tongue thrust. Either way, it's something that we need to manage. And then of course, there's major psychological benefits to having treatment early. So it doesn't always have to necessarily be a set condition. If we are able to manage treatment early, we can help sort of intercept some of the problems that can come up. You know, we all have those stories from childhood where we know a kid that was bullied in school because of their teeth or their bite, and they were really self-conscious. And I have a lot of patients that come in and they've learned to speak kind of by covering their lip, or they're using their lip to cover their teeth. And when they smile, all the pictures that they have as a child and a teenager, they're not smiling with their teeth, they're smiling with their mouth closed. And so, you know, the older we get, the more ingrained those habits become. So if we can intercept early, then we can really help work on the confidence and have our patients showing off these beautiful, healthy smiles early. So I hope that that helps to understand. Now, one question I commonly get when patients come in and parents come in at the age of 7 or 8 is they say, you know what, this just seems really early to me. I've had friends where their child started and had to do treatment early, and then because they started way too early, they had to have braces again at a later stage. And that's a really common comment that I hear. So what's important to understand is that a lot of orthodontists have adopted a two-phase approach. So a two-phase approach is where we very intentionally break treatment into two phases. So we know that we're going to do a year or so of braces early and another year or so of braces when all the adult teeth come in around 12 or 13. And we do that, we break it into two so that we can ideally avoid aggressive management like extracting teeth, like jaw surgery, and we can work with the child's growth and development. So, you know, we often go in knowing that, hey, you know what, we might be able to do this in one phase, but it's very likely we'll need to do a couple shorter phases to manage this properly.
I think that's nice, right? Because you're almost preparing them early so that they don't think something went wrong, and that's why they're receiving treatment as a secondary, right? Okay,
I
very
think
good.
with patients, it's all about setting up the expectation. And if they think that, oh, okay, you know, I'm doing this treatment early and that's it, we're set, you know, that I wish that were the case, but it's just not the case. We have a lot of growth and development that's up and coming, and we can do our best for retention. But especially when we have a lot of crowding, even if we use expansion, and that's done in a gentle way, all those little tooth buds that are developing, they're still probably packed up on top of each other up in the bone, and they may not spread out. And we only have so much control on them using when we're working in mixed dentition. So we kind of go in knowing that, hey, you know what, we're going to take a really gentle, conservative approach, but we probably will have to do this in a couple steps.
That must be helpful that they don't get like ortho treatment fatigue, you know, keeps going on and on.
Absolutely, especially if we can really be intentional about our timing, so we keep each phase of treatment short and manageable.
Yeah.
I think too, handling it as early as possible is so beneficial for so many ways, because if you've got excessive crowding, there's lack of oxygen, there's a lot of behavioral things that are really linked with not having the right form of the jaw and not having enough space. So intervention is the key. And I think for hygienists, it's a matter of us screening and educating our clients and bringing it to, if we're independent, you know, referring off to orthodontists for an assessment and an evaluation, and just being able to screen and communicate this. And I think the information you've given us so far is phenomenal. It's very, very practical. So thank you so much, Dr. Dana.
And and thank you. And on that note, if you think about it, let's say a child presents with a lot of crowding, they have a couple overlapping teeth that they can't get in and clean properly. And let's be honest, I am an oral healthcare professional. I have to manhandle my kids. I have to headlock them to get them, you know, and I'm brushing. It's hard for me, and I have the tools and the training. So if we've got overlapping teeth and they're not able to clean in between those teeth properly, let's say they have early caries and have to have those addressed at the dentist. And even if they're at a phenomenal office that goes over and above to make it comfortable, it's still very scary. And we can, you know, for some of these kids, even with our best intent, they can have a negative experience. And of course, that starting early on kind of sets the stage for, oh, I don't want to go to the dentist. They gave me needles, or, you know, there was a big scary drill, you know. So if we can avoid that, in my opinion, that's the way to go.
Very good. I was wondering if you could talk to us a little bit about sort of the differences that you're seeing. So when dealing with sort of those clear aligners versus more traditional braces, can you talk a bit about what you're seeing as far as the oral health, either risks or sort of what's happening with the oral hygiene with both scenarios?
Absolutely. And another really good question. So clear aligner treatment has really exploded into the industry in the last, I'd say, 5 or 10 years. It's becoming more and more common, and with the marketing, especially that we see in magazines and on, you know, social media and the TV, a lot of patients come in and they would like clear aligner therapy. It doesn't work for all cases, but certainly there are cases where it's a great option. Now, patients who have braces, whether they're clear metal, and patients who have active clear aligners like Invisalign, there's a number of companies, but they all, you know, have the clear tray that are covering all of the teeth, both on the buccal and the lingual and palatal surfaces. They don't have the same risks in terms of plaque retention. So patients with fixed appliances, of course, food and plaque and bacteria can get stuck in all the little nooks and crannies that we have with fixed appliances. Patients with clear aligners, they don't have those same. They might have attachments on the teeth, which are little composite resin bumps that we put on. They're specially shaped to help us move the teeth. So patients can take off the trays and they can brush, but when we're wearing our trays properly, which is 22 hours a day, we lose some of that natural salivary buffer that bathes our teeth. Because normally we move our cheeks and our lips and our tongues during regular function and we're talking. But when we've got those clear aligners covering the teeth, we lose some of that buffer. So the saliva, along with a protective layer called the pellicle, prevents the direct contact of acid from the foods that we eat or drink to the tooth surface. And that pellicle layer serves as a reservoir of mineralizing electrolytes. So it's very protective for the enamel. So why don't I pull up my screen? I've got a couple pictures that I can show you about what happens when we eat acidic foods or drinks. And I'm just talking on a regular basis without even wearing the clear aligners. So let me just pull up this next slide. So this, can you guys see that okay?
Yes.
Okay, so this is the acquired pellicle. So these two pictures are little snapshots of electron microscopy images. So the bottom here, this is enamel, and this whole gray fuzzy thing, that's the pellicle. This picture on the right is the pellicle after 10 minutes after having orange juice on the teeth. So the acid in the orange juice has attacked this pellicle, and the pellicle took the heat. The pellicle buffered the enamel. So think about the foods that we eat on a day-to-day basis. Now, we know that if I'm having a Coke or a Pepsi or a ginger ale or a power drink, we know it's probably not great for our teeth. But orange juice, which it's loaded with vitamin C, yeah, sure, it's got a high sugar content, but we think it's a healthier choice compared to having a Coke. Or what about for us? You know, I have lemon water, warm lemon water all the time, or lemon and citrus salad dressings. Foods that are really healthy can also be very acidic and hard on our teeth. And when we don't have a proper buffer, this is like I'm showing you a severe case of what happens when we have that acid attack on the enamel. This is called enamel erosion. And do you see this sheen on the enamel? Do you see how it's shiny? It doesn't have any pits or pores, and the enamel has taken on kind of a dusky yellowy hue. This is advanced enamel erosion. Now, erosion related to food from or acid from the foods, it's different than caries and cavities. So caries happen underneath the enamel surface. And what's great is if we catch caries early, it's reversible. But enamel erosion, it erodes the surface level of the enamel away, and it's irreversible. So prevention is key. And we're calling it now the erosion epidemic. So let me just give you some stats so that you know how prevalent it is in our society. So it's reached epidemic levels. Research has shown that 30% of dental patients in the range of 18 to 35 years have at least one tooth with advanced erosive tooth wear. So 30%, and these are patients who are under the age of 35. Research also shows that erosion in children can range from 10 to 80%. And this research was done before these clear aligners exploded onto the market. So you can imagine that these numbers are probably higher now. And it's a really sneaky thing. It happens slowly. We move from healthy enamel into, obviously, severe erosion is easier to detect, but we're not often thinking of that when we have our young kids and teenagers that come into our practice. We're not often thinking, the brushing looks good, the gums are healthy, but what about the quality of the enamel? Has the enamel been under attack? And that may be from very healthy foods. So I'm not suggesting that patients should avoid clear aligner treatment like Invisalign by any means. But what I am suggesting is that we need to be proactive with prevention. Now, most toothpastes, they have sodium fluoride. And that's fantastic for cavity control. But cavities occur in this higher pH range. When we get into the lower pH range of these foods, the sodium fluoride is not going to protect our teeth against enamel erosion. The only paste that has the American Dental Association seal of approval to protect against acid erosion is the Crest Pro Health. And they have a patented stannous fluoride that's stable at this low pH. And the stannous is actually, it does everything. It protects against acid erosion, but it's also good for dental sensitivity, gingivitis, plaque, it freshens the breath, and it protects against cavities. So it does everything along with hexametaphosphate, which reduces the tartar and helps with whitening. So this is a stabilized formula that's patented to this paste that protects against acid erosion. Does that all make sense?
Mm-hmm.
So let me walk you through a study. And then I'll kind of move off this topic, but it's just such an important topic to me because I think it's something, and including myself, we're all really good at sort of screening, if we've got bleeding, puffy gums, Or, we've got loose, soft plaque or hard plaque in calculus, or really, those are a little easier to detect, but the enamel erosion is sneaky, and it's in patients that have fantastic oral hygiene, as well as patients that have bad hygiene. So here's a study that was done. Now, this is called a Hawley appliance. It isn't even full coverage. So, think about the Invisalign, where it's covering the lingual part of the teeth along with the occlusal and the buccal. So this study was done, with this Hawley appliance. They had their patients use, or the clients that did this study, they either had them rinse with, a stannous fluoride, or they rinsed with a sodium fluoride, or they rinsed with water. And then they drank a cup of orange juice, 250 mils. Like, I'm not talking for this study, they had them chug a liter of orange juice and, let's really show this erosion. Like, we're talking a cup of orange juice that they drank. And then they drank this an hour to 3 hours after treatment, because I don't know if any of you guys have tried to drink orange juice after having toothpaste. It's awful. So they did this an hour to 3 hours after treatment. And what they found was the group that used the stannous fluoride compared to those with the sodium fluoride and the negative controls, they had 58% less enamel loss. Now, here we're just talking microns. So, let's be honest, it's a teeny tiny amount. Is this going to make a difference? Well, over 60 years of not being properly protected, yes, big difference. So my suggestion to patients has been, absolutely have that lemon water, have your citrus salad dressings, have your wine. I am not going to stop those mamas from drinking their wine, but you know what? Do it in a way that that you're using something that is going to protect your teeth against that acid erosion, because it's very, very serious. And I don't know about you guys, but I have acid erosion on my teeth, and it makes me sad to think about it. So, and as we lose that thick enamel layer, that enamel is what keeps our teeth nice and white. So as we lose that enamel layer, we start to show more of the dentin through the enamel. So even if our patients try and whiten their teeth, it's only going to go so far, because that enamel layer is so thin. So that yellowy dentin is showing through, and I don't want that for me, but I'm just saying. So that's just my take. I think clear aligners are fantastic, but these patients are more prone to acid erosion. And of course, they can still have plaque and caries, and those trays can act like a petri dish if patients aren't really watching their hygiene.
That's great. And I think with the stannous fluoride too, it provides that protective shield that it protects them for those for 12 hours. So that if you have them use it in the morning, they're going to be protected throughout the day and then again at night. So I think that's important to be aware of, that it's up to 12 hours of protection, which is huge. So like you say, we need to really look at the ingredients that's in our toothpaste that we're recommending, and particularly with the aligners, to use the stannous fluoride. So that's great. Thank you for that.
So Dr. Dana, taking that a little bit further, how do you set your clients and patients up for success during treatment? And I know there's a fabulous Caring Comes Home program. Like, do you implement that, and how do you find that it works? And give us any tips that we can help these clients of ours going through orthodontic treatment to be, successful and not come out with problems.
So this is actually a great segue into it. So, we have the challenging, it's a good challenge. We have patients with all different needs. So we have patients who have clear aligners. We have patients in fixed appliances. We have patients in removable appliances. We have patients that are age 7 ranging to 75. Some of these patients have different dexterity issues. Some of these patients have different home situations. Some of our patients are away at university and come back, on spring break and summer holidays. Obviously with COVID and travel, that's been a little more challenging now. So we had to be very selective about our home care kit to make sure that it was applicable to all different ages, all different types of orthodontic treatment. And so the take-home kit that we provide, we have a few different products. So we've chosen to use a Crest Oral-B electric toothbrush. We provide Super Floss. We use a Crest Pro Health paste. Of course, that protects against all of those things, that acid erosion, along with the caries, along with sensitivity, because we know that not all of our patients are going to have the same issues and needs. And then of course, we also put a Pro Health rinse inside because that adds on extra protection. So one actual new change that's come about recently has been that Crest actually just came out with their new IO brush. And this brush has just provided our parents and our patients with tools that are even more user-friendly to help facilitate with their home care routine. So for us, what happens in the practice is fantastic, but we really want to set our patients up for success at home, because damage to like white scars and decay can happen in as little as 4 weeks. So if I see my patient and something happens and I don't see them back for 6 weeks, between our appointments, I can already have patients coming back with dental damage that may be irreversible. So this new brush, it uses artificial intelligence and Bluetooth to give real-time position detection in 16 different positions. So what that means is I suggest that my patients upload the Oral-B app onto their phone or iPad, or of course, mom's phone or whatever technology they have access to. A lot of kids have phones now, so it usually isn't a problem. I suggest, hey, you know what? Download this Oral-B app, set it up in your bathroom, and then turn on your brush. There'll be a pairing process, but what it does, and actually I can show you, let me share my screen again, what this app does to help teach kids and adults on how to get all the areas using this position detection. So let me share this and let me just go. Okay, so the app has a lot of different features, and why I like it is because, my goodness, everything seems to be technology based now. Everything is online. I can't seem to engage some of my patients unless it's technology based and app based, and they actually teach me how to use some of this stuff. I'm not kidding. It's really scary, and I'm kind of embarrassed to say, but my twins, who are almost 3, they already know how to do, like, they like looking at pictures of themselves, and they do like the little swipe, and they know how to click back. I'm a terrible mom, but anyway. So like these kids are just unbelievable with this technology. So anyway, if they have their toothbrush, it will show all of these different positions in the mouth. So what happens is a lot of kids are really good at brushing. They usually are good at brushing the right, if they're right-handed, they're good at brushing the right side. They don't often get the back of the contralateral side, because they have to go around the corner. And then of course, they may not get the gum line, they may not get the lingual surface of the teeth. So this app will actually tell them what they're missing. So it has 2 pressure sensors. So we know that a lot of brushes now have a sensor where if they're brushing too hard, it'll send a little alert, but this brush will actually tell our patients if they're brushing too soft. So that's important too, because sometimes, they're like, la, 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 kind of half brushing, and maybe the brush doesn't get to all the spots, or maybe it just is not really being used effectively. But of course they go back to mom or dad and say, yeah, of course I brushed, and yes, get off my back. Well, now the parents can go into this app, and this app will actually show them what areas have been missed, you know, how long the patient has brushed for. I won't tell you some tricks that some of them use because I don't want to encourage that, like leaving it running. But anyway, it will give them a timer and time them. It will score them. So it kind of encourages like, oh my goodness. And I actually have parents, just the other day, I had a parent come in and say, ooh, you know, I was like, oh, you know, so how do you like this IO brush? And she said, you know what, it's been great. It's actually kind of, now I'm aware that we actually aren't doing the full 2 minutes of brushing because we'll brush together and the child will be using the brush and they'll be like, oh, that was only the 30-second mark. Oh, that was only the 60-second mark. So it's kind of, you know, it's helped the whole family be aware. And it does have different cleaning modes. So, you know, patients who want more whitening or want to brush their tongue, or who are really sensitive, like patients like me, where I, you know, if I have some gum recession and I've got some exposed root, I want to be a little more careful. I'm not just going to lean on that brush. You know, I want a little more gentle management. So I feel like it just, because it has these different modes, it can accommodate the different needs for our patients. The motor is a little bit different too. So they actually rework the motor. So sometimes with this electric brush, the old versions, you know, it can be really like, it vibrates and it can, you know, it'll make them feel like, oh my goodness, even my head is vibrating, or it, you know, my hand is tired. Well, this brush is really quiet. They've reworked the motor so it's actually less fatiguing in the hands. So I don't have as many kids coming in and saying, you know what, it's too tickly, or it, you know, it vibrates my brain and I don't want to use it. And the technology for my patients that are really research focused, I tell them that this Oral-B technology has outperformed other brushes in a Cochrane database study. So a Cochrane study is where they collect all of the studies that are done on a certain topic, and they look at the methodology and they determine, okay, you know, was this study done properly? Are there any biases we need to be aware of? You know, were there proper, you know, controls and techniques? And they filter out anything they think, you know what, I don't know that the results are going to be conclusive because I see errors in the way the study was done. And they filter it down to a core group of studies that meet very strict criteria. And this technology, the Oral-B brush technology, outperformed all other brushes. So that's why we chose this tool to put in our kit, because it's based on science. It's got really cool, you know, tricks and tips. And let me just forward this screen, but it's got, you know, the parents can show it can graph out the brushing over a week, over a month. And so it's interactive. And of course has all these different modes. So that's why we put that brush in the kit. Now the toothpaste that, and I get this question all the time because it's really hard. You go to, you know, the grocery store and it's a sea of toothpaste and they all look fantastic. And then, you know, a lot of times it's like, oh my goodness, what was that one that they told me about? Was it this one or was it that one? I can't quite remember. And sometimes, you know, you'll see a mom standing there Googling on her phone because you know, people really do want to make the right decision for their own oral care. The other question I get from a lot of my mom friends and patients who have had, you know, babies and toddlers. Now, it is always a personal choice. This is just my opinion, but they ask me what I used for my toddlers, you know, because I do prefer, if I can, to be natural and organic. I like to, you know, limit exposure to pesticides and anything that I think may be problematic. I think we're much more aware of these things now. But when we're picking a paste that doesn't have the proper medicine for the teeth will be at risk for caries, enamel erosion, decay, tissue health. So my kids have been on a proper crest paste since they were born. The key is for babies and toddlers to use the appropriate amount. We're not just spreading it all over that toothbrush. It needs to be the size of a grain of rice. So the one of the reasons we really moved away from, or there was a big kind of movement to get away from fluoride in children, is because excessive fluoride exposure before the age of 8 can lead to those white scars on the teeth, fluorosis. But if you're using the proper toothpaste with the right medicine and you're using the right amount, my kids aren't spitting it out, they're ingesting it. And as long as I'm using the right amount, I feel confident with the decisions that I've made. Everyone has to make the right decision for themselves. But me personally, that's what I've done for my kids. So the one we put in the bag, we use Crest Gum Detoxify Paste. It's got the stabilized stannous fluoride. It does the caries control. It reduces plaque and gingivitis. But what I like about it, and this is particular for my patients in braces and fixed appliances, is that it neutralizes the bacteria 4 millimeters below the gum line for 12-hour protection. So, you know, as much as I'm, you know, sitting here telling you, oh, blah, 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 you know, great oral hygiene, not all of my patients have fantastic oral hygiene despite our best attempts. I wish I could tell you otherwise. That is not the reality, and I would be fibbing to tell you. So I have patients, and sometimes it's not their fault. When patients are mouth breathers or have really gummy smiles and they sleep with their mouth open at night, that tissue just dries out and it becomes puffy and inflamed, and it doesn't matter if my poor patients are brushing, that tissue is just going to be puffy. So I want to make sure I'm using something that gets underneath. We're also in a big day and age, especially with COVID, we have teens and children and adults who are we're in a tough time, and patients can be on anti-anxiety medication, antidepressants, or other medication. And some of these medications cause xerostomia. And I'm going to go off topic a little bit. I have a girlfriend who's a psychologist, and they get notifications from their psychology association. And they just sent out they get it every, I don't know if it's a month or 2 months, but they just sent out a report saying the patients that have been affected most by, the clients have been affected most by the pandemic and that are struggling the most are in the teenage age group. And I wish I could remember the exact ages, but what I took home from that, it was like, say, I think it was either 12 or 14 to the early 20s. So we are going to see a big increase in these kids who are going to be on antidepressants, and that is going to affect their oral hygiene. So I want to make sure that we're using something that if they have more xerostomia than they're used to, that we are giving them the tools to help manage, these changes. And as you guys know, what we're seeing with the pandemic, we have patients with immune conditions who don't want to come in for appointments. So they're moving their appointments out longer intervals. Sometimes they have their appointment booked and then they've had an exposure or they've become positive. So they cancel that appointment and can't get back in for another number of weeks. We have patients that just want to, limit their exposure risk. So home care is critical right now.
I really love how you brought in so many different parts of this, because it's about risk assessment and giving the right tools and understanding all of the ins and outs. And what works for one client may not work for someone else. But I think it's about being aware of all of the things that can affect an ortho patient. And these all directly relate back to general practice as well. And so, I had a very interesting conversation with a client last week, actually, and it was about their child. And, she was very much wanted the natural treatment for everything. So he had come in and he was now 4 and had some quite large decay. And I said, you know, fluoride toothpaste is probably one of your best options. And her biggest worry was the fact that he probably couldn't spit still. And it was like, okay, well, let's have a risk assessment. Let's have a risk analysis conversation. I'm going to give you the information and then you can do with it as you please. But there are lots of options out there. And I think we have to be those advocates when we see them. And I really do love the IO for many reasons. But one of them, as you touched on, was the fact that sometimes kids don't push hard enough. They need to physically remove that biofilm smear layer. And this gives you that option of not too much, not enough and too much in that way. So I think that it's really well said in all the diversity. Can you educate us a bit about retention? Like, what does retention look like now for your clients? Because that's a big asset and a big concern for a lot of us.
Mm-hmm. Yeah, and excellent question, because retention has really changed over the years. So, you know, years ago, we used to tell patients, oh yeah, you know what? 2 years and you're good. Wear these retainers for 2 years and then forget about it. Or then it kind of became 5 years. Wear the retainers for 5 years. Or, you know, wear the retainers until you're 18. Then you're done most of your active growth. And then it became 21. And what happened in my case was, you know, at some point, you know, I had treatment and then I went away to university and I was kind of still wearing my retainer. And I sort of thought to myself, you know, like, I don't actually even remember what I was told about retainer wear. And I sort of thought, why am I still wearing this? I probably don't need to wear this. So if I kind of thought that, I'm sure there's lots of other clients that kind of, you know, we're just not seeing them anymore. We kind of set them free and they go off into their own lives. And then they kind of think, oh, I don't need to wear this anymore. But at least in my practice, our retention program is a lifetime program. So the reason that we've moved into this is because we used to think teeth were static and unchanging after growth was done, or at least things slowed down significantly. We now understand that's not the case. So teeth are dynamic as we go throughout life, even if we're done most of our growth, which happens in our early 20s, the lower jaw continues to grow throughout life every year, just a little bit. And that forward lower jaw growth can put pressure on the front teeth and cause things to pile up in the lower front. The other thing that changes is the pressure of our lips and our tongue and our cheeks. The musculature changes. So my muscles are not quite as robust as they were, you know, not that they were ever robust, let's be honest. But, you know, like, you know, muscles that you have in your teens are not going to be the same as the musculature that you have in your 40s and 50s and 60s and onward. As those muscles change, the pressures on our teeth change. So my opinion is that if you have invested your time and your money into treatment, why not retain it for life? That I cannot control these other factors that might come about, but what we can do is make it really easy to pop in. So what we do is at our practice, we use bonded wires behind the top and bottom teeth. We recommend those are left in as long as the patient can brush and floss around them. If we have oral hygiene concerns, then we talk about removing those and just being very reliant and very compliant with clear trays. We call them orthotains. They look like Invisalign, but so our retention program are the wires and the clear tray retainers at night. Now, these require regular maintenance over time. So the bars will chip away and need repair and replacement. The clear retainers will loosen up over time, or will have grinders and they'll bite through them. They do need to be replaced over time, but we recommend having some kind of lifelong retention, or else those teeth can move. So, you know, because our patients moving forward still wear, things in their mouths, either at night or with the bonded wires behind the teeth. We want to make sure they're keeping up with that home care kit and the tools that set them up for long-term success, because brushing continues to be important to make sure that we're not, at risk of decay or erosion in retention.
That's great. I was just thinking as you were talking, what about, what do you think the benefits are for having proper oral hygiene, throughout the treatment? Because I know, I don't want to say too much, but for instance, my nephew, he went through ortho, he asked about, his home care recommendations. He wasn't given anything. So it just always amazes me, because I feel like you're setting your patients up for failure if you're not providing them with the tools, right? So what do you think the benefits are? Or what do you know of the benefits of having proper oral hygiene during treatment?
You know what, those are really great comments and observations. It's it's funny because I can be the best orthodontist in the world and line up the teeth perfectly, and we can have a perfect overbite and perfect overjet and proper function, and I can have all my occlusal points set exactly. But if I finish treatment and I have puffy, red, swollen, oozy gums or white scars, decay, it doesn't matter what my role has been in their treatment, it is a total failure. I want my patients to be really proud of their outcome, and I cannot give them that unless we have good oral hygiene. When we have bad oral hygiene during treatment, there's a flood of inflammatory cells that just come into the area, and the osteoclasts and osteoblasts that remodel the bone and move the teeth, they can't function properly, because they have to get through all of these inflammatory cells, and the gums are oozing, and we've got bleeding. So teeth just don't respond to the forces the same way. And in orthodontics, whether we're using clear aligners or braces, we use very gentle, light pressure, low forces now. So if we're just guiding the teeth with these light forces, but we're working against tons of inflammation, things are not going to happen. And the problem with that is that then treatment drags on. And the longer treatment drags on, and if we've got appliances on the teeth, hygiene is worse, and it's just a vicious cycle. So if we can have teeth moving faster, removing the braces or getting out of the clear aligners quicker, with less decay, that's a win for everyone. And that's all related to proper oral hygiene during treatment.
Yeah, that's great.
Actually, you know what? I've got a kind of a little story on that. So my first experience with that, when I was in graduate school, we have patients that are assigned to us as the treating orthodontist. And I had this one gal, I think she was maybe 12 or 13, teenager. And I finished her case, and I spent, I really just wanted to make sure every tooth was perfect. So we take off her braces, and I am beaming inside. I'm waiting for this praise. She's going to tell me that this is just look at these teeth. I can't wait to show her parents. And we look at the teeth, and there's two tiny little white scars on her laterals. And I have no idea how I missed them. I could have just been really focused on the teeth. I didn't really think she had bad oral hygiene during treatment. And it could have literally, because it can happen in 4 weeks, it could have happened from the last appointment to her braces off appointment. And I'm telling you, that is all that her dad and she could see.
Oh, no.
And I was expecting this big, pat on the back, way to go, Dr. Dana, look at, this. and they said, "What are those white scars? Are these going to go away?" And I swear my face probably went totally white. And so instead of having this real celebration, we had a very difficult conversation. And they weren't big white scars, but they were scars.
Mhm.
And so that was my first experience with the impact that oral hygiene can have on the treatment outcome.
So what do you think the obstacles are? I'm just wondering, like, why do you think that some orthodontists wouldn't like have the whole program set up in their office? Like, I just don't understand what that would be, because you would just put it in together. It just makes sense. The studies are there. They would see it on their own anyway. Yeah, it always amazes me because they're spending the money on the treatment. Why not put together this bag of the power with all the right tools to set you up for success? There's a disconnect there.
Absolutely. And you know what? Unless they're having different patients than we see in our practice, which I can't imagine, or maybe they have some magic wand, because I would like that magic wand. I can't imagine that their general patient base is any different than what any of us are seeing in our practices. And for us, we just want to go the extra mile to make sure that we can, I can't control everything, but we can sure try and set our patients up for success.
It's a huge risk management strategy that works. I mean, the science is there, and all you have to do is implement it.
Mm-hmm.
Yeah,
absolutely. Exactly. The science is there. And so, we're going to be having those conversations in the practice anyway. I would rather spend time with my patients, educating them on the neat tools and tricks and empowering them and engaging them and getting them excited than having the conversation of, hey, you know what? You really need to do a better job brushing, because the inform, beat, and blame approach the research has proven that it doesn't work. So unless you empower and engage your patient, at least what my experience has been, you won't have the same traction.
I find that patients are really open to wanting to do it right. Like, no one puts their braces on and wants to do a terrible job brushing. They just don't. That's usually not the way it goes. Okay. And, depending on the age of the patient, sometimes the parents are so involved. And so giving them the right tools, it's really can be quite a positive experience. And when you implement programs like this, it really sets you apart, because then when they talk to their other friends, they're like, oh no, they didn't take the time. They never went over this. They didn't seem to.
I didn't get the brush.
They're always so busy, but yet they took the time to make sure I understood what I need to do, what were my roles. And again, it's about risk assessment. So if there's ways to reduce risk, I think now more than ever with the pandemic, people are open to, self-help and going after the right options. And so if this is something that you've tried to implement before and it hasn't worked, you know what, try it again, try different communication. There's tons of new stuff and ways to really market yourself and market your practice that way.
Well, there's great support for us as professionals trying to implement this program, and there's so many tools that are available to help us implement it, and then we can see that our clients are being successful. And I always tell my clients, mastering brushing is a lifelong thing. If you spend the time early to master brushing, it lasts you your whole life long.
Well, and you know what else is really interesting? So in this, you can't turn your head without hearing about COVID. Yeah. It has consumed our worlds for the last 14, 15 months. And from an oral healthcare standpoint, there's a study that came out recently, I think that came out in February, and they took 568 patients with COVID. And those patients that had periodontitis were 3 times more likely to experience COVID-19 complications, including death, ICU admission, and the need for assisted ventilation. So more than ever, apart from orthodontics, supporting our patients as oral healthcare practitioners really can impact their overall health and well-being, especially for these patients that get COVID.
Yeah, that's a pretty startling revelation, isn't it? And it's one we definitely can use when we're trying to motivate our clients to make that commitment to their oral health. Dr.
Right.
This has been a fabulous session. We've covered so many important issues here. And I think it's really only the beginning. I think we'll have to have you back because there's so much more you can share with us.
Well, I sure appreciate that. This has just been a really fun little thing to do with you guys. I just feel like this has gone so quickly. We have so many things to talk about.
True.
So
There's a few questions coming in. So just, I want to be respectful of your time and everyone's time. So what I've done is I've just put your email address into the chat. So if anybody,
Absolutely.
perfect. Thank you. So if there's questions and we didn't get to them, I apologize, but the email address is there if you want to reach out.
Yes,
Okay.
please email me. I am more than open to answering any questions you guys might have.
will this be recorded? Yes, so this will be recorded and it'll be on our portal. So if you get our On Track Tuesday emails, you'll see that link and it'll take you right to our portal. So we'll have this available for afterwards. And I'd like to thank Crest Earlby for sponsoring today, because this was a topic for us. And so it just was such a perfect fit. And it's just about getting that message out there. And with the Caring Comes Home, this is something you can go to dentalcare.ca and just look up Caring Comes Home, and you can get these packages for your clients to get them healthy. If they're not coming into your practice, you can order them for them and get them to them. You can order ahead, or you can take orders and then, you know, place the order. So some people feel uncomfortable, like if they order 12 kits, then all of a sudden they feel pressure to sell, right? So you can just share your professional pricing with your patients and just say, I'm placing an order next Friday. Did you want to be on the list? You know, there's two different ways to go about this. And then also on that Caring Comes Home, there's all these really great templates for you. You can put in your own office information, and it's all about patient education. Then we also have all these like social media posts. So if you have an active Facebook or Instagram, get the message out there. Let's get our patients healthy. And so all these tools are there. They're for free at dentalcare.ca, and just look up Caring Comes Home. And I'll put together an email as well for the after email. We do have a short quiz for today, so we can get that 1 hour CE as well. We just think this is a great way for us to, you know, to be engaged, to have something different for CE, where it's just a little bit more interactive with the 5 of us on there. So thank you so much for being a part of this, Dr. Dana, and all of you lovely cast members and everyone who is watching. Thank you so much for being here with us.
Oh, thank you so much for having me. You guys are so lovely.
Thank you.
Thank you.
Thank you.
And we're taking a break for the summer, so there won't be any more RDH View. This is our last one. We're going to sort of, maybe we might do an improv thing, but there aren't anything scheduled till September the 10th, when we will reconvene and do them again once a month until the end of the year. So please, if you haven't watched some of the previous recordings, go back, watch them. They're good for CE. And we look forward to hosting a few more events in the fall.
That's great.
Have a great summer, everyone.
Everyone,
Yeah.
take care.
Bye.
Bye.